Nicoletta, did you reform the WHO this week?
No, the reform needs a reform in itself because they are not reforming the organization. It seems to me they are adapting it to the context of a neoliberal paradigm that is still very much impending here, and we are trying to raise the basic questions that are still unanswered. Why we're doing a reform, what is the situation analysis of why there is a global health crisis, and why governments basically do not seem to trust WHO as much as they should, or as much as they need to do, as they are the primary stakeholders of this organization. So they have lots of things they want this organization to do, but then they don't associate to the topics the funding that the organization requires.
Nicoletta, do you agree with Professor Larry Gostin that you have to give a bigger role to the processed food companies and the pharmaceutical companies in governing the WHO?
That's precisely the neoliberal model that we try to jeopardize here. I think we can't have the mandated organization on global health to sell itself to those very corporate sectors that have such a huge impact on health. And it is not just alcohol and tobacco, I'm afraid. So I think that's precisely what we would like to avert, to avoid. That's why we are here. That's why we are now going to start consultations at the regional level. We want to bring, we are called democratizing global health, which is quite the opposite of institutionalizing the private sector role that already exists in this organization, where specific departments, for example, are fully funded by the Bill and Melinda Gates Foundation. This is not what the fathers and the mothers of the WHO had in mind when they created the organization in 1948, and when they created when they wove together such an amazing constitution for the organization. That it should be the opportunity of this reform to rediscover, to relaunch, to fully implement. There are many articles of the Constitution that are not fully used, adopted. For example, Article 19 on the legal function, the norm-setting power of this organization. It has been adopted only twice in over 60 years. We think that in a very thick jungle of global health actors, WHO has to reinforce this role so much more, because a jungle with no rules is not a place where global health can benefit.
Thank you. Thank you very much.